Guess who?
Hey.
What's happening? Are you sick?
What's that? I'm doing it right now.
No, I was asking, are you sick?
No, why?
No soup?
No, nothing happening today.
James.
Is James on?
Yeah, he's on.
Oh, cool. I'm still trying to wrap up. I'm trying to do the slides. Hang on one sec.
James, welcome to my world. I'm trying to do the slides. Hang on.
You want to do the slides, dude? I'll give you slides.
Did you curse?
No, I said I'll give you slides.
I have slides.
I'll give you slides.
I have
You
slides.
want slides?
I have slides.
I don't see you making slides every day.
I can make slides. If you like slides, I don't know if my slides would be very entertaining.
Yeah, 6006.
James, you're on. Let's get James up. James, you're on mute.
Dude, I've been watching that clip over and over again. It is so funny. It makes me laugh every time I watch it.
Which one?
There you go.
There he is.
The 6006 clip.
You're talking about slides. Can we do cha-cha slides?
Yes. Down, do your dance.
All right, we are getting ready to start right now. This is my last slide, and we are good to go.
Markel, I have one question.
Yes.
One quick. Did you do the slides?
Really? Really, huh? You want to go there? All right, well, let's get started. All right, welcome to the show. This is the daily COVID-19 show, Noise Filters, with Dr. Dery and Dr. Griggs. As you can see here, we have the Chief of Operations of Access Health Louisiana on board with us, who's going to be guest hosting with us today. You look so official in your desk there.
Like that with my diploma in the background.
Diplomas, yeah, it's very well placed there.
Very panel-ish. You look like a panelist.
That's panel. I want it to look nice for you.
The format of the show typically is we go over slides, so please feel free to chime in with the slides if anything kind of catches your fancy. I do about 10-15 minutes of a slide presentation, just going over the epi, and then after that we go over kind of current events. I've got today the press release that was released by the mayor about the phased openings, so I figured we would go through that and talk about that. And then the last half hour or 20 minutes of the show, we'll be kind of focusing specifically with you, talking about, looking at the importance of COVID testing, talking about telemedicine, and then also talking about what I think is the most important of all issues is the fact that there's been a decline in pediatric vaccinations, and there is a potential risk for an uptick of cases, even potentially outbreaks of things that we have not seen in a long time. So we'd love to get some of your feedback on what Access Health Louisiana is doing as a result from that. So with that, let's go over the numbers and let's do it. So we always like to start with this picture. This is a handsome fellow right here. You're on mute. Yeah, it's hard to hear you, and it's hard to hear all the things you say when you're on mute. But maybe that's for the better. All right, Dr. Griggs is keeping himself on mute, but that's fine. All right, so here we go. So you can see globally, we are at almost 4.5 million cases. That is insane. These cases are, of course, just seem to be going up every day, because they are. This is a wild underestimation of the true number of cases, and there's no question that we're seeing cases circulate through resource-poor parts of the world, namely South and Central America and then Africa, and so those cases are not being counted. This death is approaching 300,000. Again, this is a gross underestimation. You could see last night, over the past 24 hours, we've added about a little over 71,000 cases with about 4,000 deaths. And this is kind of pretty much normal what we typically see overnight. There's usually an addition between 50 to 70,000 cases, and then anywhere between 3,000 to 5,000 deaths. So this is pretty normal in terms of addition of cases we've been seeing. But I just want people to recognize that this works out to be 3 deaths per minute. So if we do this show for an hour, you could see the number of people that would die. 3 times 60, the 180 people will die from COVID-19 by the time that this is. Go ahead, Eric. You're on mute. You're on mute. You're on mute.
You muted me, man. You showed a fat doc and then you muted me. What I want to make a point of is, though, in spite of the fact that, and I have to keep re-emphasizing this, we're reopening. I don't want us to let our guard down. This is not a normal, this is part of the plateau that everyone's talking about. It's not a normal state of existence for 3 people to die per minute of one disease. This is not your flu. This might have been the flu back during the pandemic 100 years ago, but understand it's not a time to get comfortable. 3 deaths per minute, even 1 a minute. That's not normal for one thing. Sorry about that. I'll go back on mute and find something to eat and get fat again.
You don't have to go on. Save yourself off, and you don't step on your calculator again. Okay.
Don't start.
You can see here that this is the epi curve. Yesterday, I was saying don't be lulled into thinking that this curve is going down. The worldometer that we're looking at here is 1 day. These slides are 1 day ahead of these New York Times. And so yesterday we saw an uptick in cases. It wasn't showing it yesterday. So I was saying, don't get lulled into thinking cases are going to go down. And sure enough, they're not. And you're going to see tomorrow, because cases have gone up again, you're going to see this line continue. So I think all in all, I think we're seeing ourselves reach a plateau. And I think that as more countries get online with testing, you're going to start seeing cases increase over time. Now, of course, with an increase in cases, what comes with that is going to, of course, be an increase in mortality. So again, yesterday I was saying, please don't get lulled into thinking that there's been a decrease in mortality. It's hard to explain why there was at this point, but this is just going to be, when you look back over this curve over a long period of time, when we look way retrospectively, this is going to be much shorter, and it's going to just basically not even register, over the course of the next 60 days or so. But you can see that there was an increase overnight, as we expected, as I predicted, because again, the worldometer numbers are a day ahead of the New York Times epigraph. Now, yes.
In these deaths, I want people to understand now, we started with the elders and seniors, and people really didn't seem to care as much, but now these deaths include our children. I want you to understand that. As we start showing deaths, pay attention to what you're seeing and understand that all of these numbers are people, and now they are our babies.
And we're going to start seeing those very, very quickly. Here is the number of cases in the U.S. Again, we're rapidly approaching 1.5 million cases. We'll probably get there probably in about 2 days, given that we added about 15,000 cases overnight. You can see the number of deaths is rapidly approaching 85,000. We added about 1,400 deaths. As Doc Griggs says, that's 1 person per minute. I want you to realize that we make up 5% of the global population. The U.S. makes up 5% of the global population, but right now we have a third of all the deaths. As you can see, was three deaths per minute globally, and we are contributing 1 person or one death per minute. In fact, I should say 1 death. I'm sorry. 1 death per minute. And so this is obviously very distressing. As we compare our deaths, we're about 85,000. We like to look at the military deaths as a point of comparison. I remember when we were somewhere right around here, the idea of blowing through the Korean War, blowing through the Vietnam War just seemed unthinkable at the time. Now I'm just counting down the number of days. I predict that we'll probably get there in about a week and a half, that we're going to blow through World War I. And I hope that we never get anywhere near World War II or, of course, the Civil War, which had the most number of military casualties. So again, I use this as a point of comparison just so that people can kind of wrap their heads around to think about. Looking at the U.S. epi curve, again, like we said, we're about 1.3 million cases. This looked like maybe there was a little bit of a lull, but because we knew this curve was coming yesterday, I told you guys not to think of these as cases going down. Maybe this is turning into a little rolling wave. It's hard to say. As we start to see some of these southern states and some of the southern states that are going online are opening up, or as we start to see some of the rural areas, I predict that you're going to see either a plateau or you're going to probably start seeing an increase in cases. So either a plateau would be nice. Of course, we want to go down, but a plateau would be nice. But I'm sort of fearful that we're going to start seeing increases in cases, especially as states start to open up. Again, yesterday, I said, listen, it looks like this is a great trend line that we're going down. But again, we already had the worldometer numbers. We had known that the numbers were going up. And I said today, we're going to see an increase in numbers. And because we see the numbers today, tomorrow, the next graph, the next bar here is going to be right alongside. So, it's nice to, it was nice to kind of think that maybe numbers of deaths were going down. But we know that's not the case because, again, as the country is opening up, as we start to see more cases, we are going to see more death come from that. This is looking at the global testing. As you can see, again, Iceland leads the world with testing with 161,000 tests per million. You can see the US is way down the list. It's not as bad as it used to be. Again, when we first started doing this this webcast, we were at about 3 million tests per million people, but look, we finally got it to 30,000, 31,000. So that's great. We're not nearly where we need to be. Some experts say that there needs to be something like 2 million people tested a day in the US. When you go to the COVID tracking project, which basically tracks the number of tests, you can see that the total number of positive tests added to the total number of negative tests gives you this number right here, which is about 9.6 million tests that have been done. Then what we do is we take this positive rate right here and we divide it by the total test results. So that's positive and negative. And what you get is a 13% test rate. Now, again, which is very, very important for us to understand, that test rate needs to be under 5% to reflect that we are testing the general population. Because what in the past, this number was 25, 40%. Some states have them up to 50%. And what that means is that means states are testing only those that they have a test probability of having a higher likelihood of being positive. In other words, you're only testing people that you suspect for having COVID-19, but it's very, very important for us to test those that are pre-symptomatic, test asymptomatic, and just test the general population. So again, we want this number to be under 5%, and it's very, very important that we get there. Looking at the number of cases in Louisiana, we're about almost at 33,000 with 2,381 deaths. You can see in terms of the total number of cases here, Jefferson Parish and Orleans Parish just far outweigh the rest of the state. And this is largely due to a majority of the things that we've talked about regularly: social determinants of health, very high levels of poverty, concentrated groups of vulnerable populations, particularly communities of color. And you can see that overnight there has been 612 deaths in total for the state. We have a total of 34 new deaths total for the state. In Orleans, we had 4. When you look at Louisiana as a whole, in terms of the total number of cases, so these are the number of cases per capita, we're rapidly falling down that list, and it's great. New York's still number 1. We're 2, 3, 4, 5, 6, 7, 8. So that's great. At one point, we were number 1, and we've been slowly moving our way down. So we have a total of 7,000 cases per million people. So that's good. We want to be as low on this list as possible. Of course, that's not to say that these folks, but the more we test, the more we trace, the more we isolate, the more we're going to fall down that list. This is looking at the mortality rate. Unfortunately, amongst, if you look at the mortality rates of New York, New Jersey, Connecticut, Massachusetts, they're all geographically located in the same parts of the country. You can see we are the first state, again, that's a southern state that has highest rates of mortality. And again, this has everything to do with what we just were talking about in terms of social determinants of health, high concentration of people, communities of color, poverty, and then diseases of poverty, which put vulnerable communities at risk for mortality, obesity, diabetes, cardiovascular disease, diseases of poverty. When you look at testing rates around the country, we are 1, 2, 3, 4, 5. So we do about 51,000 tests per million people. We have typically been number 2, number 3. So we're slowly falling down that list. And we have an expert on testing that we will be able to talk to a little bit later today. That's going to talk to us about testing in Louisiana. Oh no, this guy, I'm sorry about that. I didn't see this was that pop up there, but this is looking at cases in Louisiana. We've definitely reached a plateau. And this is largely the reason why they've made the decision to open up the state again. The number of new cases, between in Orleans Parish, the number of new cases that they're really looking for is under 50. And here you can see our number of new cases that happened, at least in Louisiana, is 62. In Orleans Parish, it's 35. So for Orleans Parish to open up, the number of new cases have to remain under 50. When you look at the line in total, or the curve in total, this is definitely a plateau. And the only way we're going to get this lower and lower is through, intensive testing, contact tracing, and then isolation, and of course, wearing masks when you go outdoors. I am fearful, and again, hear me today, quote me tomorrow, that we're going to start seeing increases in cases again as the state and as our parish opens up. I hope I'm wrong on that, but I don't think I am. The mortality rates have remained mostly stable. I think this is going to start developing into a plateau, but of course, I hope that it goes down. If cases go up here, if cases start to go up, we will, of course, see an increase in mortality as well. I like to focus on Brazil. The reason why I do is because Brazil is running its COVID response very, very much like the U.S. is. And so Brazil is just is about a month behind us. So you're seeing cases just skyrocket, and they have the highest rates of cases in the world. As you can see, their mortality rates are going up. Yesterday, I was saying, don't get lulled into thinking that this was down. Again, we already had the worldometer that showed, but you can see yesterday, Brazil had the highest rates of deaths in the country's history. And again, I have to be very clear that these deaths are happening in targeted areas, particularly in what are referred to as favelas, specifically around big cities, Rio de Janeiro particularly, and favelas are kind of what we would refer to here as the kind of quote unquote the slums. These are the areas where people have very, very unstable housing, corrugated type of housing, that sort of stuff. And finally, here is our dashboard, our Orleans Parish dashboard. You can see in terms of new cases, we're here in orange. We're being fairly stable. Total number of deaths have been fairly stable, and testing has been fairly stable, but across the state has significantly been going up as well. So you want those tests to be as high as possible. Looking at the dashboard, continuing, we have plenty of ventilators that are available. We have about half the ICU beds available as well, and we have about 2/3 capacity in terms of hospitals. And again, this was a number, we don't need to talk about this every time, but of course, when we look at the mortality and who is being affected, of course, this is happening disproportionately amongst communities of color, in this case, particularly our Black communities. So with that, Doc Griggs, any words?
Yes, stay home. I'm predicting now in the week of June 1st And the following week, we're going to talk about the numbers going up, and we're going to see spikes. If my mood has changed, it's because I was just informed that there are people that are already planning parties this weekend. Parties, like we're free parties.
Like mask parties?
Yeah.
Like maybe they're planning face masking parties.
Yeah. Right. But that's the attitude. There are happy hours being planned. There's a lot of things that are really disheartening, considering the fact that what I know the three of us have been through, and it felt like the last year, but it was the last few months. All of us sitting in a room not knowing what to do, but we're going to do something. I lost the equivalent of a small child in the last 2 months, and I'm just getting my appetite back. We're just going to have to brace ourselves for the phase of reopening, and all we can do is continue trying to educate. I can't wait for our next expert to come on so we can give an insider. We know the perspective of the healthcare systems, the front lines and the ERs. Doc, we're sitting right there. You're seeing patients as they're coming in, not knowing what the symptoms are. We know it all the way from the TV, all the way to the clinic, all the way to the ER, all the way on the streets, but nobody knows what goes on a large scale. When we say pressure on a system, James can not only speak about testing, but he can talk about being part of a system. It's another level of responsibility to be responsible for all the patients and all the employees in the system, and you have no idea where the pressure is coming from. So I'm going to go on mute and just kind of brood for a minute. I can't believe someone's really throwing parties, man. It sucks the wind out of you, you know?
Yeah, I bet. James, any before we go on, any thoughts about any of the data we presented, or?
No, I think it's obvious that, as we kind of give in to stay-at-home fatigue, that folks are, feeling really stressed out by that, and I totally understand it. What I would say is that that's when wearing your mask, washing your hands, don't touch your face, which clearly you don't have to type in. I know I typed my face 3 times so far. And then try to limit your interaction with people, social distance, all those things that we know we can rattle off by heart. Now is, if you are going to venture out, don't get out of those things. So keep doing those things as you venture out into stuff. And, there's no other way to say it. It's irresponsible to throw a party right now. I know we want to. Trust me, I want to hang out with my friends and do all that stuff. Everybody wants to do that. But for the safety of all of us, including you, it's important not to give in to that temptation, and kind of limit that, and ease yourself back into the world. Don't jump into the cold water that fast. Yeah,
it's certainly wise thoughts there. Let me just kind of finish off here. Usually at this point we jump to our do you want to here, let's do this next. Here, let's go over this is Mayor Cantrell's. This was released yesterday. Was this yesterday? Yeah, this was released yesterday. This was a and I thought that we could go over this detail. This was a press release from Mayor Cantrell. This was her press release yesterday. So what she says are the first of 4 phases that will begin on Saturday, May 16th at 6 a.m. How much do you want to bet Friday night it's going to possibly be free-for-all in Orleans Parish? Of course, the mayor loves to use the word intentional because she is intentional. So she says, we've been intentional and shaped these guidelines based on science. So this is great. So what is some of the things that she is doing? So they've reached several key milestones. Steady decline in cases. That's what we talked about, 14-day decline in cases. There needs to be a testing capacity in place, a healthcare capacity, and a readiness for contact tracing and plans in place to isolate and contain potential outbreaks. So when we just jump back to this this dashboard, you can see that that's what this is here. And what they're trying to show us is that there is preparation, and they're going to know on a day-to-day basis, as well as this stuff, because if cases start to go up, you're going to start to see this uptick here. That's what you're going to see. We see in Louisiana the cases are going up, but in Orleans Parish, fortunately, we've done a really nice job of making sure that our cases remain kind of in place. So, but she did state that folks need to be vigilant. Seniors and people with serious medical conditions should stay home. Now, here's the best part about it here, and I don't know if you guys got it on your phones, but there hopefully is now going to be a mandate. I personally have been trying to do everything that I could do to try to make a mandate that everybody must wear a face covering in public. I'm here in a public space where I have an office, and everybody wears masks here as well. It's incredibly important to do so. I know where James is as well in his public space. He wears masks as well. Continue to practice social distancing. Gatherings are still limited to small family groups, no larger than 10. Eric, these parties, are these carefully curated parties of just maybe 5 people or 6 people just amongst family, right?
Yeah, they made sure to go over the epi curve and to make sure that the percentages are not too high. No, man, they are partying. People don't hear reopen, they hear party.
All right, so they say all essential businesses and organizations will continue to stay closed, with some exceptions, and we're going to go over those exceptions. But what I do love here is that there's strict requirements for social distancing, face coverings, and other PPE, hygiene and cleaning products. So what are we looking at? So operations in phase 1, shopping malls and retail stores, but this is only limited to stores with exterior entrances, right? To limit 25% of permitted occupancy. So that's going to be kind of interesting. Food service establishments, right? Restaurants with table service should utilize a reservation or appointment system. So my one thing here is restaurants with table service, to me, I'm having a hard time wrapping my head around it. Indoor seating is a very, I am very, very concerned about this. I do like the reservation or appointment system. And Doc Griggs, do you know why that's there? Or do you want to explain why that's there?
That's the contact. That's part of contact tracing, and that's something that we'll probably get into as we get closer to Friday, because I've been told that the state is really going to ramp it up come Friday. Contact tracing is a system of where they actually test, trace, and isolate. They monitor whether or not you're positive or you've been exposed, and then it's a system of questions where they ask you where you've been, your last contacts have been. Particularly within the last 48 hours, you're told to go quarantine or isolate yourself from the rest of society, and you're quarantined for a minimum of 14 days. Test, trace, isolate. They're varying lengths of isolation and time, but it's just part of a data system to keep us socially responsible and our community safe.
That's right.
So Griggs, question for you. As you were talking, I'm just thinking. So if I went to a restaurant and I wore my mask most of the time, like when we were waiting for the food, and I only took my mask off when I ate, and I put my mask on again, would that help reduce my risk?
Well, anytime you're wearing a mask, it reduces your risk because there's less understanding that this mask helps you keep your bugs, your virus, your potential virus to yourself. When you take it off, you're putting more out in the air. It would reduce the risk of those around you, and it would increase the risk. But this mask does not filter out the virus. The virus is 0.1 microns. The safest thing to do is stay home. But
I was trying to throw that out there of like, obviously you can't wear a mask while you eat.
Right.
But if everybody in the restaurant wore their mask all the time, they weren't actually consuming food, the waiting, after the chatting, that at least we could limit the amount of exposure that other people in the restaurant would have.
Yeah.
I think folks might get the impression that since it's open and it's only 25%, then I don't need to worry about the mask because I'll be good because it's only 25% of us in here. And
that's right.
That's why I was
then
asking that question.
Yeah, that's
yeah,
good.
he was setting it up for you, as you like to
Yeah,
say.
he really was. I was really, Doc, I was really thinking about that study that we'll allude to at another time with the contacts in HVAC systems that we.
I was gonna just mention it right now.
Yeah. Okay. So bring it up, James. That's where I thought you were going, but go ahead.
Right, the famous study now. I heard about it like 2 weeks ago, and I think I brought it up to you, Doc Griggs, and I've talked about it a few times, but now I'm seeing it everywhere because it's such a perfect illustration of what happened. One guy goes in to eat, he gets about 9 other people sick. He was asymptomatic or pre-symptomatic. He was seated at a table with a air conditioner that was 90 degrees from him. He got everybody at his table sick, plus people on both sides of him as well. And so we know that as the days start getting hotter, that people are going to want to be inside, and that air conditioning is certainly should be considered a risk factor for viral transmission. So again, the idea of table services, and I am very concerned about the wait staff who probably are not going to be given N95s, because N95s are the type of masks that likely prevent the virus from being absorbed or inhaled in. And so I predict that within about a month or two, we're going to probably see restaurants around the country be recognized as being foci for infections, and we're going to probably start closing them down. That's my prediction there. Bars only with food permitted, and you can see that no restaurant or food establishment should serve any alcohol beverage to a patron who's not purchasing food. What they're essentially trying to do is eliminate bars altogether. Dr. Avegno, during her press conference, made a very specific point about another famous story, an article that came out about a young man who went night clubbing and bar hopping in Seoul, South Korea, and is now responsible for something like 80 people being infected, with 6,000 people now in isolation. That's how boom, 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 they were able to do that contract tracing so quickly. So of course, takeout and delivery is highly encouraged, and like James said, 25%. We are seeing beauty salons, barbershops, and nail salons. I don't know how they're going to do this. I don't know how a barbershop that's been a barbershop for a long time is going to rearrange chairs. I don't know if they're going to do one, I don't know how they regulate it. If you have 4 chairs, do you just then only use 1 and 3 and then 2 and 4 and alternate days? I don't know how that works and how that's going to happen. When you're looking at places of worship, I'm gonna James, I'm gonna let you kind of you're kind of a bit more of an expert here with houses of worship. I know that you had some words yesterday at our task force meeting.
Yeah, so I think I actually have gotten much more information in the last 24 hours from the United Methodist Conference on how we should go about opening. And then I read an article this morning about some folks are upset about that 100 person number, that if their congregation, the 25% of it is more than 100 people, who do you choose not to come to church and things like that. So I would say one of the guidelines that I think is really important around that is folks in the high risk category should not be coming back to church yet. And I know that's really hard to hear if you've been out of worship for such a long time, but 100 people are 100 people. 100 people singing is not good if we're not all wearing masks. So I think that we each person needs to be kind of responsible for when it's right for them to go back. I know that there are folks that there is a lot of shaming and blaming going on of people who don't do a particular thing. So be careful not to fall into that kind of category of that kind of trap. But I would say that you really do need to think about when it's appropriate for you individually based on your current condition of when you should go or not. I'm going to recommend for my church that we continue with the online service in addition to when we open. We and my church have no intention of opening in the next few weeks. And then when we do, there'll be a whole bunch of things that we take into consideration, making sure that we're, 6 feet distance, that we're wearing masks, that, we don't do donuts in the fellowship hall, and that we're careful when we walk in and out. We use more entrances and exits into the church, things that we might not normally do to really kind of spread people out as much as possible. Wear a mask, and then clean everything, frequently, wiping down the places that we normally touch in a church, the ends of the pews, the front of the pews when you hold them to stand up, all those places where we might touch things, and then hand sanitation places all through the church.
And then Doc Griggs. Yeah. Doc Griggs, did you want to talk to us about why it's bolded here that no choirs are permitted?
So yes, there was a CDC put up a graphic earlier, and it was in Skaken, Washington. There was a choir where 56 people, from one person, 56 people ended up getting infected. 87% of the choir became infected from one person at choir practice. The sad thing, as we're saying all this, is the three of us can acknowledge nothing has changed. The virus, we still have no cure. We still have no vaccine. We haven't changed our recommendations. James was saying we're going to social distance and wear masks. We're going to wash. You saw us washing nothing has changed. So to actually go out and think we could do the things that got us in this situation in the first place, without regard for the fact that the virus, the reason the numbers have gone down is because there's been less people out. That's it. As soon as you put people out, the virus is like, hey, where you been? Come on. And we're going to get sick again. It's just.
It's the same reason why we don't have as many traffic accidents or speeding tickets, is because we just have not been out. We just haven't been out on the street.
Right.
Nothing has changed. So, there it is.
Yeah.
So here was choir practice right here. Here was the index patient. So nothing here. Index patient gets sick. Choir practice happens, and then boom. You have folks that are sick, and it was something like 50 some odd people. And so
56.
56, yeah, just an unbelievable
52,
amount.
I'm sorry, 52.
So what happens when you sing? Wow. In fact, I have a surprise for you guys, because that's the way I roll. You guys ready for a surprise?
You gonna sing?
Dude,
I am not gonna sing.
I was about to say, James, where's the mute? Where's the mute? Mute it.
But you guys ready for this? I have a surprise for you.
Oh, wow.
Oh, a video.
Yes.
Now I'm recording. Stay healthy. Great. Stay healthy. Great. Less loud. Stay healthy. Good. Are you recording? Yep. Stay healthy. Louder. Stay healthy. Louder. Stay healthy. Nothing.
Cloth mask?
Mic drop. I thought you guys would love that.
Yeah, that's cool.
Like talking and singing, and that singing has so much more coming out. Which
of course.
Yeah,
absolutely.
That was really cool. Now that was with a cloth mask, right?
That was with the cloth mask. That was on the New England Journal. That was just published a couple days ago in the New England Journal. And when I saw that, when I was doing my research for Mass last night, and I hopefully will have this article finished by tonight, or at least a good solid version of it, with a lot of evidence behind why it's so important to wear a mask. When I saw that, I was like, okay, I'm going to surprise Griggs with that tomorrow.
Yeah, that was awesome.
I figured you would love
folks,
that.
When we say cloth mask, we mean a mask made literally out of cloth. You can make it with a scarf or a bandana. It's not an N95. Yeah, that was amazing.
These were random materials at home that that my wife just made. With the nose bridge, she just used tinfoil for the bridge of the nose. I mean, these are just, and then shoelaces or just random little things. I mean, anything actually really works. And so just let me just kind of wrap up here our slideshow here, and then we'll just get to kind of chatting with James here. I don't know what to think about this. I mean, I know what I think about it. I think, yeah. It's a very difficult, James, I would love to hear your thoughts on this. We haven't talked about this. I from an administrative perspective, as somebody who has hundreds of employees that have children, and the difficulties in managing employees who have children, that the system worked when they went to school, right? That was the whole point. And then now that whole system's been overturned. We want to try to get the system working again. But the issue here is that we're very, very, very concerned about children going back to school and potentially continuing to transmit virus. So just some thoughts on there?
Yeah, so I'd say for us at Access Health Louisiana, we've been particularly lucky. It's a very small percentage of our workforce that doesn't have childcare to take care of their children while they come to work. But I know that that's a rarity. That's probably not the average person. They're depending on daycares and schools and places to take care of their children while they go to work. That one is just, quite frankly, really, really hard. I don't think there is an easy answer. I think, there are precautions that can be taken in the school or daycare to make sure we're wiping everything down. But, I think some folks are not going to be able to go to work because they are not going to have a place for their children to be taken care of. If you're at a minimal capacity, like how much space does a school have to spread people out?
Yeah.
If it's a small daycare center, they're going to be able to take 20%, 25%, only 50% of the kids that they would normally take care of. And they got to figure out how to keep kids apart and not touch anything and don't put anything in their mouths and don't lick on the slide and all those things that kids do. I think childcare and schools are one of our biggest issues that does prevent people from getting back to work. Even if they could go to work and work safely, who's going to take care of their children? And then to throw on top of that, this kind of dramatic increase that we're seeing in children being hospitalized and dying of Kawasaki syndrome-like kind of pretty horrible thing for children that in big cities we're seeing more and more and more of. Mm-hmm. So that's questionable too, because now all of a sudden it's not that we just need to worry about that the child might bring that home to us. The other part is that our child might be now at pretty significant risk. So
it's very, very difficult.
But I don't really understand, there's no, we don't have a really good alternative. And I think one of the things that, kind of the greater system, the governmental system, the school system, all those systems, are not prepared to do this, but I think it's where a lot of energy and resource needs to go, because you're not going to get a lot of people back in the workforce if there isn't a place for their kids to go during the day. So as much effort as we're putting into testing and treatment and preparing for surge capacity in hospitals, I think now is the time for the fall that we really need to be figuring out how do we put the resource to school systems so that they can do that. And I haven't heard anybody really talking about that. And that's probably my biggest concern is folks are going to have to start sending their kids to school. And the system is not going to be prepared for all the things that they need to do. They are school systems are very resilient. Obviously in a few days, they went from nothing to online classes. So I think it's resourceful. But spreading things out and having less kids and having school in the daytime and at night cost a lot more money. And I think, we need to be encouraging and have our voice heard for resources going to school systems so that they can take care of kids.
You know, Access Health Louisiana has a strong network of school-based clinics as well. Has there been any preparation? I mean, my concern is what you referred to, is the multi-system inflammatory syndrome, and it's very concerning. And so, how has Access started thinking about what they're going to be doing with their school-based clinics? I would imagine it's going to probably be a lot busier. Yeah. So how has Access responded?
So, you know, we right now we have 16 school-based health centers. For the fall, we'll have over 20. You know, we recognize that, you know, one, we probably need to be more focused on summertime this summer than we normally are. Normally we shut down about the third week of May and we go, bye, we'll see you on the third week of July. You know, call us if you need us. But this year we're really focused on, you know, those behavioral health patients, making sure that behavioral health patients are taken care of through the summer. Another big group that we're focused on is seniors. So any senior that's preparing to go to college or to trade school or community college or something next, they really need to have their final immunizations. So we're really focused on trying to figure out who those folks are, making sure that we get them immunized before the end of May, because for some of them, they're going to age out of their insurance coverage, either provided through their parents or Medicaid or commercial insurance or wherever. And these immunizations that get ready for kids going out of high school are very expensive. And so we want those covered. So we've been focusing on doing immunization drives. So we call those folks, schedule an appointment, go in the parking lot with the staff in PPE and give them their immunization. So we focus a lot on that. Across our whole system, we're focused on a couple of groups of kids, those under 24 months, because there's some very important immunizations that get started there, and that we want folks to bring their kids in for their immunizations. I understand people are nervous about coming into clinics. I can assure you at Access Health, we are cleaning everything. Folks will come in mask and gloves. They will make sure that they're keeping you safe from us. And they're going to give you a mask and they're going to have you wear a mask so that you can hopefully keep us safe from you. But your children need to get their immunizations. I would hate for us to have a really uptick in things like mumps, measles, rubella, all those childhood things that, you know, there's nothing worse than going on YouTube and watch some child suffering from whooping cough and coughing and having trouble breathing. It's particularly horrible to watch. So you need, even if it's not Access Health, you need to get your child immunized for those things, especially under 24 months. And then the second age group that's really important because you get your second MMR booster between 3 and 4 years old. So we're focused on those three groups of kids to get them immunized. And then especially for kids under 2, it's really hard to do a telemedicine visit with an infant because a lot of that is by looking at them and touching them, moving them around, and then the pediatrician can get a good idea of what's going on based on the interview with the parent and a physical exam. So as I know you're nervous, I really do understand that parents are particularly anxious about themselves and their children, but please reach out to your pediatrician, your medical provider, especially if your child's under 24 months, you want to get them immunized. And if your child's between 3 and 4, really reach out. Some of that is like, they'll just do the immunization. We might not do the whole entire well child check, but it's at least the opportunity for the provider to take a look at the child, see if there's anything going on. And if there is something going on, obviously that's the things we want to catch early so that we can intervene, and then you don't have a problem later on because we've kind of stopped during this time period. So as things open up, please, please, please contact your provider. If it's Access Health, just call your clinic number. If it's any other provider in the community, just be sure that you're getting your child taken care of with those immunizations. It's extremely important. We will end up with a totally different problem if we don't.
And one of the things that clinics are doing, including Access Health Louisiana, is that they're staggering or creating spaces so that sick children are coming in the afternoon, vaccinations are happening in the mornings. So this way moms and dads feel comfortable. If they are just coming in for vaccination, they know that they're not going to be sitting in a room with other children that may potentially be sick. Is that correct, James?
So at Access Health, we are, they are scheduled first thing in the morning. So they're coming into a clean clinic. We are in our smaller clinics where it's family practice. We will not, if we had any adults scheduled, there will be no adults scheduled. It will just be appointments for kids. All of those morning appointments for adults and everybody else will be via telemedicine. So there won't be other folks. It's first thing in the morning. It's specific days of the week so that it's not over the whole entire week. No, that's probably not as convenient, but it's definitely easier for us to make sure that we keep everything clean for you. So when you come, you're coming into a clean clinic. You're not coming into a clinic with people that are sick, either kids or adults. You're going into a clean exam room. When your encounter is finished, we're getting you back. We're probably not having you sit in the waiting room. When you walk in, we're going to check you in and put you right into the room. So you're not going to sit in the waiting room. Then we're going to wipe everything down to make sure that you're safe and your child's able to get that immunization. Yes. So I would say that all providers are doing those types of things to keep everybody safe.
Great. And I'm hopeful that I think with some of these interventions, we'll be seeing that kind of, there's been a decline in vaccinations. Hopefully with these interventions, there'll start to be increases in vaccinations. I will say this, one vaccine that I know, and I'm wondering from an administrative perspective, if it's possible to get more or if there's just a limit on what we can do. But I have a feeling that we're going to probably run out of flu by probably mid-November. I'm guessing by Thanksgiving, flu shots will be completely sold out. And so is there some plan? Have you heard our vaccine makers making extra flu vaccine for what may be a rush?
No, I haven't heard that. And honestly, we have already placed our vaccine order.
I was going to say.
Happens early at the beginning of the year. There's usually a second round that you can actually add. Most times when we've done that, we end up with some at the end because it seems to be so far into the season when you get them. Although I would just say, just seasonal flu, it's now used to be, September to February. Now it's kind of August to May. So we really do have an extended flu season. Unfortunately, over the years I've been working at Access Health, it just seems to get longer and longer. So I suspect that everybody that doesn't normally get one is going to be like, I better go get my flu shot.
That's what I predict.
You are one of those swing immunization flu people where like sometimes I get them, sometimes I don't, but I think this year I want to go get it. Go early.
Yeah, please come early. We've got about 10 minutes left. I'm going to just kind of jump to one of my favorite part of the segments of this show is making fun of the goofiness of some of the, we definitely want some of your input on some of this stuff, James.
We're not making fun. We're not making fun. We don't do politics, we do science.
I'm not saying we're doing politics. I just say it's interesting to look at some of the headlines and comment on the headlines.
Yeah.
This first headline here this is something serious, so this is nothing to laugh about, is that unfortunately epidemics and pandemics have a history of influencing policy. And here we're seeing that there's an order that's being reviewed to extend border restrictions indefinitely. And I can't say how much damage that's going to do over the long term, especially from asylum seekers who are seeking asylum in the U.S. because they're running from countries or situations that are quite violent, especially some of the drug cartels, especially some of the violence in Central America. Any thoughts from either one of you guys about that, or?
That's kind of water is wet. I'm not surprised by that.
Yeah, no, that sounds about right.
Yeah. Here we see the economic damage could be permanent, and I think that is I think we know that as well. This is really fascinating. The Texas Attorney General warns Austin, Dallas, and San Antonio over defying state orders. Now, you would think that the defying of state orders was to not follow the stay-at-home policies and mask wearing policy, whatever. No, it's the exact opposite. They went further than what the state told them to do. They went further. They were more. And they were like, no, you shouldn't have done that, which is, again, this is counterintuitive. It's
in those areas where, like, there were more cases being diagnosed in those areas.
Yes. And that is going to be a theme for our podcast tomorrow. In fact, please download our podcast. I can't believe I haven't, this is my first time I'm saying it. I usually do it all throughout the show. Doc Griggs and I have a show called Noise Filter. It's a podcast. It's a 10-minute podcast, very high yield. It's available first thing in the morning, where Doc Griggs and I break down complicated scientific and social issues regarding COVID-19, and we give it and deliver it in a very conversational way. I'm actually very funny with it. Doc Griggs is still, I think, on mute. Or
so
no?
he's actually very delusional with it. Dan, do you have a pulse ox? I need to check it.
I like that high yield comment. So for those that don't know, I think that means it has a lot of good content to it and it's interesting, and you probably should listen to it because it's informative.
Thank you, Stephen. Health literacy.
Knowledge is the yield. Knowledge is the yield.
Bam.
I don't know if you guys heard, but the whistleblower, the guy who was helped make vaccines, who was fired because he refused to promote hydroxychloroquine, is now calling 2020 as the darkest winter in modern history. And I think that is something that we're well aware of. Last two stories here. Hunger is spreading. We know that hunger in Orleans Parish is 40%, food insecurity is 40% amongst children. And I think that this pandemic we're going to see more of that. And then again, as James was talking about, we're seeing far more children in New York that are believed to have this multi-system inflammatory syndrome, which looks kind of like Kawasaki. So James, do we have any programs at Access Health that help address hunger, or are there things that we can do to help kind of alleviate some of that?
So whenever we find out about it, we push out where food drives are happening. So look on our Facebook page and Instagram, a lot of stuff. I know it's on my face. A lot of really good information that gets pushed out. If you do hear of those places and you're listening, put them in the comments on the Facebook page so other folks can see it. I will tell you that if we know about a testing site, a food site, and a mask site, that there's going to be 100 people at the testing site. There's going to be 1,000 people at the mask site, and there's going to be 2,000 people at the food site. And so I think the local communities all across our network are really stepping up to help. Churches, community organizations, Second Harvest are really working really hard to get food out to people, which makes perfect sense. And that's not going to stop anytime this year. That folks, even, think about that. If you're a waiter or a waitress, or your business can start 25%. That means that 75% of the time you aren't working or making money. I don't know about you all, but I don't know very many people that can live on 25% of their salary without getting some additional assistance. And so those things, we're going to push out what we know, but please let us know if you know of them so we can spread that word.
James, we have another minute or two. Did you want to maybe give some quick information about testing sites and availability of testing?
Yes.
So across the state, the Office of Public Health and Homeland Security, along with the National Guard, are standing up testing sites in as many places as they can. The governor's talked about trying to get 200,000 tests done every month. That's 6,500 tests, 6,500 tests every single day, 7 days a week. We are helping at 4 different sites. Hahnville and St. Charles Parish. We'll be doing another site in St. Charles Parish in Kelowna on Friday. We're working in Welcome, Louisiana, in St. James Parish. And then we're doing 2 other sites that move around together with the National Guard and the Office of Public Health in St. Mary Parish and Assumption Parish. If you go on the Louisiana Department of Health website, you will find that listing. Then kind of drill down, there's information numbers, call. I would encourage you, if you have any concern over whether or not you might have been exposed or you might have it, there is no longer, you need to have symptoms, we need to check your temperature and none of those things. Are you 18 and over? So we're not testing adolescents and children. If you're 18 and over and you're a resident of Louisiana, you can get tested at those sites. I know at the sites that we're participating in, we're not at full capacity. So some of those tests are being spread out in the community to other places like nursing homes and group homes and places like that. But I know the sites that we're working at every day, we are not running out of tests. We're not using all the tests for the day. So I encourage you to get tested if you're concerned. It's one of the ways to at least know what's going on with you. And if you are, then you can take some precautions to protect your family and the community.
James Como, who is the Chief Operating Officer at Access Health Louisiana, thank you so much for joining Noise Filter, our daily COVID-19.
Hope we didn't bore you to death. Hope we didn't bore you to death.
It was high yield. It was very much
high yield. High yield.
Yeah. I'm glad you thought it was high yield. Thank you very much.
High yield.
See, now you know what Griggs and I actually do every day, right?
It's good to know. I'm going to have to start watching to make sure that you guys are behaving yourselves.
Oh my gosh, dude. Damn, the stories I could tell.
Like brothers.
Stories I could, it's always his fault.
All right, guys. Well, thank you so much. We'll see everybody here tomorrow at 4 o'clock. We have a special guest tomorrow. One of the council members for Terrebonne Parish will be on the show with us. He has some really interesting stories. Terrebonne Parish is really making a big push to be wearing masks. And tonight at City Council meeting, they're going to be doing it on Zoom and wearing masks as well. So that's going to be awesome. We'll be talking to him. So thank you, everybody, for tuning in. As always, thank you to our AETC team. Thanks for Chris Atkins. Thank you, Graham Patterson. Thank you, Sydney Soublé. Thank you, Eric Griggs, for always putting up with my shenanigans. As he would say, get checked, get fit, get moving. Yeah. I would say, stay home, wash your hands.
Oh, that's not what you say. Don't act like, don't behave because James is here. No, say what you say. Yeah.
I say health is a human right.
Peace there you out. Go.